So, Bismillah Rahman Rahim, Assalamu alaikum. My name is Dr. Fawad Suleiman. I work as a consultant psychiatrist. So, the main aim of making this video is to facilitate medical students and professional doctors so that they can understand how to take history related with substance use. So, today I will be particularly discussing about how if some patient is taking heroin. So, what is pertinent in that history? You have to go, you have to ask about what various elements of history you have to cover. So first of all, you have to, as I have previously discussed in my sessions, that you have to make a very good relationship with the patient by introducing yourself and taking the introductory details from the patient's end. And then you can start up with your interview, and then you can ask the first thing we all know, that is history of presenting complaints, that for how long he or she is using heroin, if they are particularly using heroin, and what was the dose they initially started. Either they were able to increase the dose over a period of time, and what was the route how they were taking. Either they were taking via snuffing or via injecting or via smoking. So we have to ask about the route and how much of the amount of heroin they are using right now in these days, and a bit more about, um, do they just use heroin, or beside heroin, uh, is there something else like mixing alcohol? So that is also the case. Sometimes the patient also complain that they are using something else than else with heroin. Another pertinent thing you also have to ask about, um, is the patient injecting himself with heroin, or do they share needle with others, so that it red alerts chances of various infections. So this was history of presenting complaints as far as heroin is concerned. Then you can ask the history of dependence. So as far as the criteria of dependence is concerned, there are 6 areas. Number one, you can ask patient that, do you have strong urges to use heroin? Number two, do you find yourself unable to stop those urges? Number three, do you think that you just have increased the dose just to have the same effect which you used to take with lower doses, right? It means that with passage of time, for the same effects which the drug was producing at lower doses, now the same effects are being produced with the higher doses. So this is number three. Number four, evidence of withdrawal symptoms. Did you ever try to quit heroin? What kind of symptoms did you experience? That was number fourth. Now number fifth, despite of knowing that heroin is harmful, heroin can damage so many organs in the body, and this, if even though the patient is taking heroin, so that means that he's aware of the consequences, hazardous consequences on his physical health, but even though the patient is taking heroin. And then number six, that is, do you find heroin, do you prefer heroin on other sources of pleasure, like do you prioritize use of heroin? For example, some people take fun by watching movies, by seeing TVs, or doing some other activities. In this particular scenario, the patient prefers heroin or other things, right? So these were the 6 points. So if 4 points are present in any history, then we can say that the patient is dependent. So we are done with 2 areas: history of presenting complaints, and the second one, um, we discussed about criteria of dependence. And thirdly, you can ask about complications. So always remember, the physical complications with heroin use is, if he or she is injecting, then we can ask about risk of communicable diseases like hepatitis B, C, like risk of HIV and some other contagious diseases. Another, so in the same way, you also ask about other substances, but in this session, we are particularly emphasizing on heroin. So I would be discussing about heroin only. And then you can ask patient that, did you ever experienced seizures, fits, right? Or another thing you can ask, that what's the place where they are injecting. If the patient is injecting, you have to definitely ask what's the body place where they are injecting themselves with heroin. And if we besides, you can also ask about that, because of heroin use or because of your difficulties or struggles with use of heroin, do you find that social relations became difficult? Do you find it difficult to mingle up with people, or people is this the case that people have negative attitude towards you as you are using heroin? So that was the number third area we discussed about complications. And then we do mental state examination. We do ask about symptoms of major depression, but because of um, because of time limitations, we do not ask in detail. And then you can also elicit symptoms of psychosis. And then lastly, you just have to check inside of the patient that what do they think about their use of heroin. Either they want to get rid of it, or either they want to continue it. Remember one thing: if until the patient has not agreed or given you a consent, you cannot proceed with management. It's quite difficult. For example, you start treating patient on the same day or on the next day, there are chances that the patient may again start using substances. And risk of suicide, to elicit about risk of suicide, is also a pertinent area to be assessed in substance use history. So this was a bit about history, how to obtain history if someone is using heroin. Another thing, which is very proven, you can always tell patients that if you don't treat heroin withdrawal symptoms, these are not going to kill you, right? If you do not give medication, but if they can manage with their pain and other, loose stools and tummy aches and headaches and other autonomic symptoms of anxiety, if the patient is able to manage with, then they can manage with their symptoms. And this is not necessary that someone will die without being treated. So I thought that this might be useful for you people. Um, so I thought that it is worth to make a video and share with you people. Thank you so much for your time.